Once you have a patient of central retinal artery occlusion at your hand, now once you have a differential diagnosis at your hand and you want to narrow down the diagnosis towards a definitive diagnosis of central retinal artery occlusion or either a branch retinal artery occlusion, what are the specific findings that you're going to look for in that particular patient? Again, when we examine the patient, the management of the patient or the evaluation of the patient starts right away from the history taking. What are the particular features that we're going to look for when we take the history from that particular patient? Obviously, the patient particulars are again very important. Knowing the age, the gender of the patient is very important. The age group that is particularly affected through this central retinal artery occlusion is almost around 60 years of age, and it's usually the men that are primarily affected rather than the women. So these are some of the patient particulars that are again very important. And then we move on to the other factors that are very important. The presenting complaints, of course, that will give you, the patient will give you a history of a sudden loss of vision that was severe enough and it was painless, and it is again mostly unilateral rather than bilateral. So this would be the presenting complaint, and then the past history of the presenting complaint or the history of the presenting complaint would include the infections, or if there is any history of hospitalization due to endocarditis, or in some cases there is going to be a diagnosed case of endocarditis at your hand, and one of the complications of endocarditis is the central retinal artery occlusion. So these are some of the findings in the history, and then we'll move on to the systemic history. Knowing the systemic history over here is again very important. In this particular case of central retinal artery occlusion, we're just focusing on atherosclerosis, any history of autoimmune diseases. For example, it can be the giant cell arteritis, any spasmodic contractions of the ophthalmic artery even can dislodge a thrombus, and basically it can cause a decrease in the blood flow to the retina, which can be severe enough to affect the inner retina as well, and that is basically going to complete the definition of central retinal artery occlusion in this particular case. So once you have gone through the systemic history, the family history, the genetic history, the socio-economic history, they are all going to basically correlate towards giving you a definitive diagnosis in this particular case. Once you're finished off with the history taking, the examination is again very important in this particular case. First and foremostly, we're just going to inspect the eye, and usually this inspection is carried out on the slit lamp examination. Usually the patient is made to sit on the slit lamp, and you're going to examine the patient's eye in detail. And that is when basically you're going to observe the rubeosis iridis in the iris of that particular patient. That is one of the signs of the central retinal artery occlusion in this particular case. And then we're going to move on towards ophthalmoscopy, and these findings are basically the mainstay towards the diagnosis of central retinal artery occlusion in any particular patient that we're talking about. So what are the findings of ophthalmoscopy in this particular case? It can be the cherry red spot appearance. It can be the box scarring that is observed in these cases. Then we have the retinal artery accentuation that is observed in these cases. There is an optic disc pallor that is usually noted down on ophthalmoscopy. So these are some of the major findings that you're going to look for, and that are going to basically lay the foundation towards the diagnosis of the central retinal artery occlusion in this particular case. Then there are the arteries which are also known as the anterior and the posterior cilioretinal arteries, and that are basically giving you a collateral blood supply towards the retina. So there is some variation from person to person in the findings of this cilioretinal artery, and we'll be discussing that over here. And then the fundoscopic findings will be discussed in detail as well in this section. So just going through the ophthalmoscopy that is regarded of in this particular case, we're just going to have a look at it, that the opacification of the retinal nerve fibers and the ganglion cell layer, usually there is a retinal whitening that is observed in these particular cases. So this is due to, again, the ischemia of the retina, which is caused by the occlusion of the retinal artery. The visible ophthalmoscopically, where the ganglion cell layer is more than one cell thick. So it is one of the findings that is observed, that is the macula, except the foveal region, when the cherry red spot is seen. So the cherry red spot is almost seen in almost 90% of the patients, and that is basically giving you the definitive diagnosis of the central retinal artery occlusion in this case. The fundoscopic findings that would be seen are the retinal periphery in the central retinal artery occlusion cases, and it appears basically normal in a lot of cases. Typically, the retinal opacification that is seen, it resolves over a period of 4 to 6 weeks in these patients. So this is again very important, that usually the periphery is going to be appearing of a normal intensity, and when we look at the center of the retina, there is going to be the appearance of the abnormal neovascularization and the cotton wool appearances, or the cherry red spots that are seen particularly in these cases. Cilioretinal artery is one of the variants, or is one of the collateral blood supply that is basically supplying these structures of the retina. So knowing this artery is again very important. The major blood supply is of course from the central retinal artery, but again we have these cilioretinal arteries, and any blockages of these cilioretinal arteries is basically going to present to you as a branch retinal artery occlusion, and it's again going to be there's again going to be a peripheral or a central loss of vision, which is again going to be painless and sudden or unilateral. A patent cilioretinal artery is very important for functioning retina, supplying some or all of the papillomacular bundle is again very important over here. So knowing this structure, this cilioretinal artery, it's basically after the ophthalmic artery has arisen, and after that there is an anterior and a posterior central cilioretinal artery that is observed in these cases, seen in approximately 1/3 of the cases. So it is one of the factors that has to be seen. Then we have the box scarring appearance. That is again very important over here. You can see this cattle trucking that is seen over here. This cattle trucking that is observed on the fundoscopy is basically forming the foundation towards a definitive diagnosis of the central retinal artery occlusion. Box scarring, or the segmentation of the blood column of both the arteries and the veins, occurs secondary to the separation of the blood serum from the erythrocytes in a stacked or a rolle formation. So this formation or this mechanism is basically named as being a stacked formation, or again it is also known as the rolle formation, and this phenomena is known as the box scarring, or it's also known as the segmentation of the blood column in the retinal arteries. So basically in this section, we summarized the findings on the ophthalmoscopy or on the fundoscopy, which are of significance, and they're basically laying the foundation towards the diagnosis of the central retinal artery occlusion. So that is the end of this section. Thank you for watching sqadia.com.